Hello, and welcome to Data Basics, Understanding Data Quality Discussion. My name is Howard Morrison, and I'm an Early Childhood Technical Assistant Specialist with the DaSy Center at SRI Education. Today's course objectives are to understand the characteristics of high-quality data, why it matters that data are high quality, how to improve data quality, and how to apply Part C and Part B 619 data. Let's start by talking about the characteristics of high-quality data. The IDA Data Center states, high-quality data are timely, accurate, and complete. In addition, they're usable, accessible, and secure. Providers and administrators at the local, state, and federal levels use high-quality early intervention and early childhood special education data to inform their decisions as they work to meet the needs of young children with disabilities and their families. So let's talk a little bit about what that means. Let's start with accurate. When we indicate that the data is accurate, we mean that it's correct and a truthful representation. Accuracy also means that the data is reliable, so it is consistent across reports, locations, and time points, and that it is valid, so it measures what it is designed to measure. For an example, an alarm clock rings at 6 a.m. Monday through Friday, but is set to ring at 6:30 a.m. Is this reliable and valid? It is very reliable because it rings the same time each workday. However, it is not valid because it is not ringing at the time you want to get up. You can learn more about reliability and validity by watching the Data Basics Reliability and Validity recorded webinar found on DaSy's EC Data U webpage. Timely data means it is current and up to date and submitted on time. Complete data means there are no gaps in the data. Consider, does your data represent the entire population? Is it representative across key subgroups? For example, do your family outcome survey results include all families in your program, or are subgroups of families underrepresented? If you are interested in a child's developmental progression, does your data include enough data points to determine a child's development over time? For accessible, usable, and secure, we want to ensure that the data is easily available in a user-friendly format and maintains the confidentiality of those who are the subject of the data. Let's now focus on how high-quality data applies to Part C and Part B 619 data. Data quality is important because without it, you cannot effectively make decisions about program operations, accountability, or improvement. In fact, poor data quality has significant impacts on the efficiency of program operations. Data quality encompasses many attributes, such as reliability, validity, completeness, and timeliness. These attributes are supported by and require people, processes, and data systems dedicated to quality assurance at both local and state levels and throughout the data lifecycle. We use quality child, family, and program data to ensure eligible children with disabilities and their families are receiving the appropriate programs and services. High-quality data also helps us evaluate how children and families are doing and to identify what additional supports they may need. Having quality data also allows leaders at the local, regional, and state level to make informed decisions about program operations and improvement. Lastly, programs must report on their performance, which informs their state performance plan, otherwise known as the SPP, and annual performance reports, or APR. Ensuring this data is high quality allows state and federal leaders to analyze, evaluate, and provide the technical assistance supports necessary. We've introduced you to how we use high quality data and how it applies to Part C and Part B 619 data. Now I will share some strategies for improving data quality. When engaging with Part B and Part C data managers, or the individuals responsible for entering, collecting, and reporting data, it's critical to show purpose, use, and value of the data to really get at the why. This makes the process more transparent and increases motivation to collect high-quality data. Ensuring staff have the tools and resources they need to collect, evaluate, and use data are key. This may be done through professional development at the local, regional, and state level. Supports for data use can include things like data entry support or protected planning time to eliminate barriers and reduce challenges. It's important for programs to have rigorous data collection and data entry procedures. At the local level, it's important to have standardized procedures for collecting and entering data, data entry qualifications and training, timelines for data entry, and data entry checks. At the state level, it's important to have procedures in place to support local programs, such as assigned state data stewards, formal timelines, available file naming conventions, established storage locations, support documents, FAQs, opportunities for stakeholder input, regular training for new and established local staff, and a help desk. An ongoing process to support data quality is periodic review, record review. For example, this could be when a team convenes and reflects on the accuracy of the reported data. To support high quality data, there are multiple data quality considerations that the state and local agency should consider, in addition to the strategies for improving data quality. Let's run through some of them. State and local agencies should have data governance structures and procedures in place to support Part C or Part B 619 data quality. For example, this would include a written detailed data dictionary, established decision-making authority, and documented security and access procedures. As previously mentioned, state and local agencies should develop standardized procedures for collecting and entering data. These include, but are not limited to, data entry qualifications and training for staff, timelines for data entry, and data entry checks. Document how duplicate records from multiple agencies or multiple service providers at the local level are handled, how are incomplete data handled, how are local agencies informed of potentially missing data. These standardized procedures should go documented and regularly updated. State and local data systems should have edit checks to help reduce or flag errors in the data. Data staff should identify and track additional edit checks that would be beneficial for future releases. Data quality reports should exist for state and local staff to share with colleagues and other agencies for review, updates, and correcting data. A state agency should have procedures in place to support local data staff and determine clear processes. For example, agencies should have assigned data stewards, formal timelines, available file naming conventions, established storage locations, support documents, FAQs, opportunities for stakeholder input, regular training for new and established local staff, and a help desk. State and local agencies should determine how staff assess data quality issues. How do they know what to look for, how to assess data quality, and how to improve data processes? Local agency staff should collaborate with the state staff to clean and edit data. This will help know who, how, and when do local staff review and edit the submitted data. It's important for state and local staff to have the capacity to recognize, understand, and collect and use data such as, but are not limited to, data related to child development and functional skills, assessment, IDEA compliance, and results indicators. For more information on this, please visit the DaSy Data Culture Toolkit on the DaSy website. Select Assess and Improve Data from the left menu bar. Under the Data Quality Considerations tab, you'll find more details on data quality considerations. Included on this webpage are resources at the state and local level that team members can use when exploring and documenting issues related to data quality. To ground the characteristics of high quality data in application to Part C and Part B 619, let's make a connection through child outcomes example. Child outcomes data focuses on 3 developmental outcomes for all children served in early intervention or early childhood special education under the Individuals with Disabilities Act or IDEA. So 1, children have positive social emotional skills, including social and emotional relationships. 2, children acquire and use knowledge and skills, including early language communication and early literacy. And 3, children use appropriate behaviors to meet their needs. Now, program entry, having accurate data are important for the local early intervention or early childhood special education program to understand a child's functioning in order to identify and provide the best supports for the child. A final assessment of progress is completed upon the exit from a program. Comparing the final progress data to the initial data gathered at entry into the program shows change over time. Which states are required to be reported to the Office of Special Education Programs for all children that exit early intervention or early childhood special education at least 6 months of service. This collection of assessment data at entry and exit presents many challenges for data quality. Examples include the accuracy with which the data assessment method measures the 3 functional outcomes, or missing data at entry or exit, or late assessments, or lack of usable assessment data reported back to providers. In summary, high quality data are timely, accurate, complete, usable, accessible, and secure. Collecting high quality data requires attention to people, processes, and data systems. Data quality impacts practice and policy decisions. We need data to be high quality so that the decisions that are made are valid, and service providers can be the most effective, and children and families can achieve their best outcomes. The DaSy Center designs and delivers technical assistance for Part C, early intervention, and Part B, 619, early childhood special education state staff, supporting their efforts to collect, report, and analyze high-quality data. We provide a continuum of TA for state staff and data managers from all US states and territories. Please reach out to us or your state liaison to inquire about ways we can support you. The next 2 slides provide resources to help further explore data quality. Thank you for participating in Data Basics, Understanding Data Quality. To learn more about the DaSy Center, please visit us at dasycenter.org and follow us on Twitter at DaSy Center.